Hello, nerdy grads. Welcome to another exciting course from our setup. This is about dental, oral nutrition, and health. We are going to see a detailed review about how we are going to manage oral nutrition with good health practices and what are the issues associated with this small dental issues and how it leads on to major problems. Uh, with with this intro, I'll just move on to the course contents. Let us see what all this course deals with. These are the modules that are present in this course. I'm first I'll be dealing with the introduction, just giving a basic about your teeth setup, how a teeth, the mucosal layer and the saliva and everything. The second module will be talking more about oral health and advices, basic advices, what are we follow. The third module handles uh, nutrition and general oral health, especially what happens during malnutrition. Malnutrition doesn't have to be always associated with poor eating. It can be because of old age, unable to eat conditions, unable to eat healthy food conditions. And the fourth module handles the effect of oral health, dealing with carbohydrates, proteins, fats, vitamins, and minerals, and how each one plays a role in being kind of enhancing the teeth health. The fifth module deals with calcified minerals. What are the minerals that are important for a strong teeth and which one deteriorates it? And the sixth module deals with under 5 years, that's the kids and the elderly, and what are the special care they need to take. The seventh module deals aspects of dental caries. What are dental caries? Basic information and what can be done to prevent it. And the eighth one deals with the gingivitis and periodontal diseases. The ninth module deals with the condition, nutrition and oral cancer. What has to be done from the nutrition point of view. The 10th module is about nutrition and oral candidiasis. The 11th module deals with the nutrition and other mucosal diseases that are very commonly prevalent. So in detail, let me tell what is present in module 1. Module 1, as I told you, is the introduction that talks about the teeth, general definition of a teeth. And it speaks about the parts of teeth and what are the types of teeth that we have as humans, and general introduction about nutrition and balanced diet and the types of food we consume and how the digestion happens, where it is getting absorbed and the metabolic activities. And from the dental point of view, we are going to deal with the nutritional systemic versus dietary local effects in module 1. So what is going to be the content for module 2? This is the oral health and advice, basic information. And second is a pre-eruptive, the pre-eruptive teeth condition versus post-eruptive influence. So what influences how much in your teeth formation and those factors, and the special position of enamel among the oral structures. So how the enamel is formed and how it influences your good oral health conditions, and how it is relevant to nutrition in maintaining a good enamel, and all those aspects should be covered under module 2. And what is the physical character of the diet should be there when you consider a good enamel and a strong teeth. Now the condition for module 3, content for module 3, when you did talk about malnutrition, is malnutrition versus oral tissues. How are the tissues going to be affected first, because they are supposed to be very healthy to maintain a healthy teeth, and which affects what? And eating disorders, because a lot of people get because they have other eating disorders. And malnutrition can also be because of dental implants. Because of lot of dental implants, people will not be able to eat normally. So how are we going to deal with those conditions? And a general conclusion on this topic. Module 4. This will be dealing on the effect of nutrition on oral health. How carbohydrates is going to play a major role in affecting a good oral hygiene and health, and proteins what do they do? What is their role in shaping a good teeth? Fats and lipids and vitamins and minerals, especially very important. Module 5. What is the role of calcium? This is a very, very important topic you will be covering. Basically, I'll be talking about the introduction of calcium. Then what happens when there is a calcium deficiency to the teeth and the symptoms of calcium deficiency in the teeth and hypocalcification, because there will be a lot of reasons for hypocalcification, symptoms of hypocalcification, and how it ends up in a dental plaque. Now, module 6. Module 6 will be talking about the age group who are predominantly affected with dental problem, focusing on under 5s and the older people who have a prominent issues with dental maintenance, good health maintenance. So, what are the challenges that they face? Infant and children's oral health, nutritionally, how vulnerable older people will be there and what will cause them to not maintain a good oral health issues in elderly, and small snacking tips that can be suggested to the children and as well as older people. And basic conclusion for this module. Let me explain content for module 7. So this will deal with the dental caries alone. Introduction to dental caries, how the formation of dental plaque will further proceed to make it into bad caries, factors influencing the formation of dental caries, and major role of carbohydrates and dental caries. What are the best ways for prevention and treatment from our point of view? I mean, nutrition point of view. Now, this is module 8. Module 8 will talk about gingivitis and periodontal diseases. This will be giving you a definition for gingivitis and periodontal diseases. What are the symptoms of gingivitis and how does it manifest by itself? And what are the etiological factors? So how to maintain a good nutrition when somebody is suffering in gingivitis? And what are the treatment plan in gingivitis? And what are the other conditions prevailing? Once somebody gets a gingivitis, they'll also be developing other periodontal conditions. So we'll be talking about that in module 8. Module 9. Module 9 deals with a very important condition. It's oral cancer. It comes under the head and neck division of cancer department. And the basic definition, we'll talk about the symptoms and risk factors, role of nutrition in oral cancer management, dietary adjustments for oral cancer patients, importance of macronutrients in oral cancer, managing the side effects because of the cancer treatment through nutrition, which is very, very important as they have to build up on their energy lines. Post contents of module 10. So this is nutrition in oral candidiasis. Candidiasis is a type of infection. So what are oral candidiasis and how does it manifest itself and what are the types that people come along with the complaints, and etiology and history and physical definitions for oral candidiasis. How do we treat and give a nutritional management for that? Following which is this module 11. Module 11 is dealing with mucosal disorders. So first I'll be explaining about the mucosal disorders, giving you an introduction and what are the types of mucosal disorders. Role of nutrition in oral mucositis. What are the roles played by water-soluble vitamins and fat-soluble vitamins? And what are the roles played by minerals in mucosal disorders? And the formal conclusion for module 11. So with this, I'll give you a general information of what we will be dealing with this dental oral nutrition and health course. So following this, we will move on to module 1. We'll meet you there in module 1. Thank you, Nerdy Grad Folks.